patients are going to play much more of a role. I think a lot of the things that we see in hospitals are going to end up moving to home care. I think there's going to be a shift to using technology to bridge the gaps between equity and digital divide. But I actually do think, how do we make sure that we're not letting our regulatory kind of reforms kind of get in the way of things? How do we make the best out of the resources we have while in parallel thinking about the long term and having a decentralized system, which is what we have both provincially, municipally, globally, is going to be the reality. But I think there are so many things that we can do to optimize that model.
Hey there, folks. Welcome to today's episode of the Strategy and Leadership Podcast. Today, I'm joined by Shanil Ebrahim, who is one of Canada's top 40 under 40. He's a partner at Deloitte in the life sciences out of his division. He's a consulting leader, does a lot of cool stuff. He's part of giving back to the community, a fellow, Canadian thought leader. So, Shanil, I'm very excited to have you here. Thanks for joining us.
Excited to be here, Anthony.
And I should also say a listener of the podcast, which is how we got connected in the first place. So it's always cool to see, the impact that we're having and the people that are, that we're rocking with. But why don't you tell our listeners a little bit about who you are, and then I'll get into some questions.
Yeah, absolutely. So as you mentioned, I'm currently a partner at Deloitte, and I'm incredibly privileged to lead our national life science and healthcare consulting business. And those who are not familiar with Deloitte, it's the world's largest global professional services firm, and we offer a pretty wide spectrum of services in consulting, audit, tax, financial advisory, and risk advisory. And we have a global team of about 400,000 people. And in Canada, we have approximately 14,000 people, and it's continuously growing. And right now, in my role, I oversee a pretty dynamic team of life sciences and healthcare practitioners, and we do everything from doing complex strategies for organizations, streamlining operations, to implementing cutting-edge tools like an AI, digital, and a health solution. And we also have a big human capital business, which is around preparing organizations for the future of the workforce as well. So that's a little bit about me.
Cool. And you're on a couple boards as well in your spare time?
That's right. So I just finished serving as a chair of Wellesley Central Residences, which is a supportive housing organization for low-income seniors and those with HIV. And I'm also a board director for the Children Treatment Network, which serves over 29,000 children with disabilities as well.
That's awesome. That's great work, and I think it's just important for all leaders. You have your day job, air quotes, but then be able to take that opportunity and experience and bring that back to organizations in your community. And I know that, from getting to know you a little bit, that's really, really important. I would ask you, of the 14,000 people that work in Canada, do you know Jeremy Fish? But regardless, shout out Jeremy Fish, who works for Deloitte in the Toronto office.
I do know Jeremy Fish.
You do know Jeremy Fish?
I do.
Okay, that's awesome. He's my dog. So we'll talk about that after. I'll send him this episode. So, Shanil, one of the things that you do, you're consulting with a bunch of different organizations in growing and innovative spaces. What are some of the needs, concerns, challenges that you're seeing in the field as we move kind of into 2024 and looking into 2025 and 2026?
And when you talk about the needs of different organizations, are you thinking more cross industries or within healthcare?
Oh, well, specialized, focus within healthcare, given that that's your niche. But if there's anything else that you want to share, I'm all for it.
Yeah, so absolutely. So let's talk about the number one challenge that all healthcare organizations are facing is around human health resource shortage. We don't have enough clinicians. We don't have enough technicians. We don't have enough nurses. We just don't have enough of anything right now. And pandemic has made it much, much worse because a lot of people who are in the workforce decide to leave the workforce, especially those who are older than 55 years old. And the pandemic was also a time where we halted immigration. So a lot of the immigrant workers that used to come in to play a role in these jobs are not there as well. So we are in a dire need of dire need of resources, and there's a significant shortage. And typically one of the first things that we would say is, well, let's try to increase it at the earlier part of the career. So let's put in more seats in med schools or in undergraduate and create more jobs. Well, that's not working either because a lot of those positions are going unfilled because healthcare jobs are not as attractive, especially in clinical roles like general practitioners, like it used to be. So the competition is actually getting less. So this is a big long-term problem for us in Canada. And so we are trying to think about different ways of working. So one is thinking about how we work a little bit more globally with different countries and trying to bring different practitioners together. The other thing that we're also trying to do is being much more creative in terms of, I would say, targeting underutilized resource pools. So typically those who are female, visible minorities, indigenous groups that are looking for these type of jobs. How do we actually attract them through the right forums? Because these are underserved. It's an underserved workforce who would be able to actually address some of the barriers as well. And then we also thinking about technology, right? Thinking about AI, automation, digital tools to one, enable that engagement cross borders as well, but also being able to use these tools so that the human doesn't always need to be in the loop. So these are different ways that we're starting to see a workforce reform. That is probably the biggest challenge that we're having right now. So that's one.
Can I just? I just got a question because that's we could probably spend hours just talking about that one because I find it interesting. So we have like the human capital part of it, which is kind of upstream. You have the hiring practices, which would be internal, and then you have the technology, which in principle is external, and then the adoption is internal. And that, with healthcare or medicine, it applies across, I think all industries are having a similar challenge. What I can't help but think of is, okay, let's say as an organization, I'm running one organization, I'm the CEO of a hospital. That could in principle be a three-pronged strategy, but all of them are super long-term. And then I think of all of the different stakeholders that are like part of this problem, because as a healthcare leader, you have to then engage with universities or high schools. You have to deal with like government to support better immigration policies for that. You have to work with like the College of Medicine to be able to like incorporate those technologies and in like a unionized environment. So I'm asking you as like a representative of Deloitte, like how have you seen leaders be able to kind of navigate that complexity? So not necessarily what to do about it, but what have you seen and how is the progress being made at getting all of these various stakeholders trying to solve a common problem?
Yeah, it's a
just a softball question for you there.
Yeah, it's a great question, right? So the workforce crisis cannot be overlooked irrespective of which stakeholder you are. So from a clinician standpoint, they have significant burnout. So one of the things, one of the solutions that we're putting in place to help them navigate around this is how do we alleviate some of the tasks that they do on a day-to-day basis to other professions, right? Like a great example is nurses can end up taking a lot more. Not that nurses are not overloaded themselves, but they can end up taking a lot more just in terms of the barriers that clinicians face. There are other healthcare professionals like pharmacists who are taking over some of the tasks around like minor ailments where they could start to prescribe for things like diaper rashes or UTI or allergies, which no longer you need to go to a GP and you can just go to your pharmacist at a Shoppers Drug Mart or a Rexall, right? Which was a big movement that we've seen across Canada. So that would be, one of the big things that we're doing in terms of policy and government. It's actually working with them to actually figure out how do we create a reform where we can actually address things along the full journey. So this is around how do we ensure that we're making these type of jobs much more attractive right from the onset, because right now it isn't, which means new incentives, new structures, new type of training, new type of skill sets that they would need to be able to get. So that's another. And then also just in terms of how we're actually getting the government and the private sector to be able to address some of the financial sustainability about it, because ultimately this comes down to healthcare financing in some ways. So bringing in together value-based care models around aligning the payment structures to patient outcomes, which could actually help decrease the amount of work that we end up basically doing on a day-to-day basis as well. So those are some of the things that what we're doing right now. And we're working with so many different entities, as you can imagine, from a Deloitte standpoint to be able to address it. It's a complex challenge, but it takes all these different pieces to come together to be able to address this big behemoth of a problem.
Yeah, and I think that that's one of the things, and why I ask the question with such, I'll use the word magnitude, is because Deloitte as an organization, and again, this is, I'm interviewing you who happens to work at Deloitte, there's so many things that you touch in there, but one of the things that I heard, that's like a practical tip for our listeners, is looking at your entire value stream and saying, hey, where can we, and I use kind of like despecializing certain things, like looking at the roles and responsibilities within your organization and seeing how you can adjust your processes so you're putting less of a burden on certain people, and I'll call it more of a burden on others, but better streamline, and I'll use the word optimizing certain tasks so that you can do it. And then what I also heard in terms of a potential, use air quotes, solution, is adjusting the processes and systems by which our healthcare or medicine is being funded. And in my brain, I joke that I'm going to go to like the Frito-Lay's operating room because we're going to get like corporate sponsors for certain things. But, it is fundamentally, hey, how do we get the money that we need to do the work that we do, and how, as a society, we value healthcare and medicine. We talked technology a little bit earlier. So we talked about despecializing certain needs, and then let's say including technology to optimize certain processes. And I was talking to somebody the other day, and they were saying about like a breathalyzer that would be able to like detect, let's call it a type of cancer, because of the data analysis this technology could do. How do you see the trajectory for these, very powerful technologies, dare I say, revolutionizing or at least optimizing how organizations can deliver healthcare?
Yeah, fantastic question, right? And I think this touches quite nicely from how we use technology to address some of the healthcare workforce crisis, and being able to implement those innovative solutions to improve patient outcomes. And they go hand in hand, and they align quite well, right? So the first one I want to talk about is efficiency and automation. So there's technologies like AI that's automating your routine tasks, from administrative duties to more complex diagnostic process. So think about it from healthcare professional standpoint. Like when you go see your family doctor right now, they're talking to you and they're entering notes into their computer, which is an electronic medical record that keeps that digital record of you. Now, one thing a lot of people don't know is for every hour that a doctor spends with a patient, they're spending 2 hours in documentation. That's a lot of administrative burden that they have, where they can actually allocate to patient care. So that's leading to a lot of burnout. But now we're having these AI-driven tools out of like the Amazon medical platform, or now the Google LLMs that have been coming in, which are analyzing just speech when I'm actually talking to a patient, or analyzing images from radiographs, and helping manage these patient records, which streamlines workflows and reduces the whole manual burden on staff. So that takes care of improved patient experience, because I'm talking to you directly, but it also reduces the workload, which actually streamlines a lot of the efficiencies that we're talking about and manages that care. So that's one way that I think is just fantastic. The second thing, and I think we've been talking about this much more increasingly as a result of the pandemic, is everything around telehealth, virtual care, remote care. We had these technologies probably for at least even a decade, I would say, probably even longer, right? But in the pandemic is when we really started talking about it, because we were forced to use it, and now it became the primary mode of care. So these type of this type of expansion truly has been a game changer because it's made healthcare more accessible. So now patients who are coming from remote regions who didn't have much access, now they have a lot of access. So great in terms of patients, but it also redistributed the workload amongst healthcare professionals because a lot of these academic centers, in downtown Vancouver or downtown Toronto, they're the ones who are generally really overloaded. So now we're able to see where the pools of capacity are, and we can actually distribute it accordingly. And that's a great way to optimize a limited workforce as well. So that's another way as well, just in terms of how technology plays a role. And the third one I actually want to mention is around data. We collect so much data, by the way, in healthcare, and we don't use enough of it because a lot of these systems are not designed in a way to provide insights back out to individuals. So whether you are a clinician or a patient, imagine if you can use that data for effective workforce planning. I understand where the demand is. I put the right type of staff against it. Imagine if I, as a patient, which we all do with our Apple Watches and so on, we're able to monitor some of our health conditions remotely. So this way we don't end up having to go to a doctor all the time, and we play a role in our care. So these are just different ways that I find like technology plays a role. And all of these are very powerful examples that are being used on a day-to-day basis that I think could end up changing the dial in terms of both the optimization of resources and an improving patient outcome.
Cool. I mean, I hope so, because it's important. We obviously have a crisis. And so let's say, like, working backwards, like data collection. One of the interesting things I see with healthcare organizations is say, hey, we're outcomes based and we're using best practices, but they have no idea how to collect the data that drives, like, informing best practice business decisions. And like from a strategic lens, it's like, hey, what are your KPIs? And I'm sure some organizations are great at it. And I've seen some that are just going on gut because they've been doing the same thing and it's like working. It's kind of like the marketing. 50% of my marketing works. I just don't know which half. And I think that applies for medicine. Wonder question. Do you think we will ever move to decentralized healthcare where like you could have like one healthcare provider across Canada that does everything? Obviously there's risks there, but so that you could optimize the Canadian and or global workforce. Do you ever think that there's a future with that?
No,
Okay.
I really don't. Right. And the reason is because the alignment that we require is going to end up being onerous. And I think we will end up spending a lot of resources to try to get to a model that may not even be the most optimal way to actually get there. So the question is, how do we make this? I don't know if you mentioned centralized or decentralized. I don't think we're going to get to a centralized model, into a completely decentralized model where now we're going to see different pools of resources to increase access. I do see that, where patients are going to play much more of a role. I think a lot of the things that we see in hospitals are going to end up moving to home care. I think there's going to be a shift to using technology to bridge the gaps between equity and digital divide. But I actually do think, how do we make sure that we're not letting our regulatory kind of reforms kind of get in the way of things? How do we make the best out of the resources we have while in parallel thinking about the long term and having a decentralized system, which is what we have both provincially, municipally, globally, is going to be the reality. But I think there are so many things that we can do to optimize that model.
Yeah, and that was I probably used the wrong choice of words there. Before I forget, one of the things you talked about was like telehealth. And you talked about that, like, we've had the technology for a long time and we like underused it. And then I think of like all of these efficiency automation, and you use the like large language models for somebody to be talking to it and increase basically overnight 50% efficiency. How do you see, from your experience, the rate of adoption with those tools? Because, of course, some of them are, on the cutting edge, air quotes, around like adoption. But then you have old thinking industries, in many cases, not all, like healthcare, who are like, hey, we're burnt out, we're overworked, we're doing all of these things. We have technologies that are new, innovative, and could have those opportunities. But then you have the human behavior change, adversity, change resistance of adopting them. What are you seeing with the CEOs that you talk to, and how are they navigating, incorporating and adopting that change at a appropriate speed?
Yeah, great question. So I'll take it from the end where you mentioned, what are CEOs talking about? So all CEOs that I talk about are mentioning we need to be tech enabled, we need to be AI driven, we need to start adopting it. Usually the organizational cultural barrier is not at the top. They're the ones that are least resistant to change. It's usually when it goes down to the end user, like the clinicians who have to end up using this for patient care. And one of the first reasons that there is a pushback in terms of any of these new technologies in terms of being adopted is either they're not user friendly or they integrate poorly with existing workflows. And what I mean by that is, I'm just going to take that electronic medical record example that I mentioned. Imagine we're like, hey, we can actually make this so much easier. We're going to put another device here. It's going to listen to you, and you just have to end up pushing a few different buttons, and then it's going to end up transcribing it. And then you just enter the password in a certain way, and everything is going to be done for you. And it sounds great. It's going to end up cutting things by half, but they don't end up doing it because they're like, hold on, so you need me to go to another system, and now you need me to log into that? Like, what am I trying to do here? So they stick to their own workflow. So the question is, how do we integrate these tools into the workflow that is very seamless for them and there's no disruption to their established routine, because that causes the biggest resistance to technology and adds to the workload as opposed to easing it. So that's the first one. The second one is, a lot of times we end up thinking it's like a iPhone, right? You end up providing to any person. Is intuitive. People can end up using it and they're going to end up having confidence. But the reality is most of these technologies aren't as intuitive, and they need some level of training and support. And there's a lot of insufficient training on new technologies where clinicians feel unprepared or anxious about using them effectively. And that undermines the whole confidence in the technology and the perceived utility of it as well. So that's a big part. And then another big one, which is always looming over everyone, is everything around concerns of patient care quality, patient privacy, patient security. Because as you introduce technology, there's a little bit of a black box kind of feeling where you don't know if the data is going to be private. Is it going to be secure? These are fundamental concerns that clinicians have. So what do? They go back to manual ways of doing things as opposed to digital. And the reality is we have so many safeguards when it comes to digital and technology that it actually poses less risk than sometimes these paper copies in terms of patient confidentiality. But that training, the support, being able to provide them the literacy is going to be key to getting over that barrier as well. So we need to think about how do we not only look at a top down, which is what sometimes a lot of us do, how do we work with those end users and get those champions on board to actually create that change within the organization?
Awesome. I think that's, apt, and it makes tons of sense. The ability for it to manage the resistance, to make it user friendly, to make the integration with systems seamless, and then providing sufficient training and support, and then that mental and very real balance of, I'm too busy to train someone and I'm too busy to learn, and so the default is easy. And if you're listening to this podcast, you're not in healthcare, but you've ever rolled out an ERP or any large piece of software, hell, a Monday board, and someone's like, oh, I don't want to do this, it's hard. And it's like, well, yeah, but it's you have to be able to put that. You can't just buy the thing. You have to invest in the training and the support to integrate it. And in something as, I'll use the word, as personal as healthcare, you have some staunch resistors because it has been done a certain way for so long. And so, an even greater need or importance for leaders to be able to balance both the outcome that they want to do, but the support And then the last thing I thought was just so smart was, instead of the top down approach, which there's part of it that has to be like that, but the bottom up, to make sure that like the end stakeholders, the end users are really like bought into the change, and really understanding not just the what, but the why, and then ultimately the how, and that they're given time, money, energy to drive it forward. So, great takeaways here. Just as we finish up, Shanil, is there anything else that you want to share with our listeners, either about where you see the future of technology, where you see the future of healthcare, or the future of leadership as we finish up?
Yeah, great question. I think the only thing that I would mention, which I probably didn't talk about enough, is the role of the patient. We've been using the words patient centricity for a very long time, for decades. Everyone says that they're patient-centric, but in reality, I feel like we're getting, or it is getting its appropriate attention now. And I think there's a lot to consider with this, because one of the things when we think about as Canadians, there's some fundamental things that's important as a country. And the first one is access to care, which means not just physical access, but also financial and digital, like a lot of the things that we're talking about. So how do we use all the things that we're talking about to provide services that are accessible to everyone, irrespective of geographical barriers and socioeconomic status? And I think thinking about the patient at the heart of that is going to be a critical aspect. And in relation to that is also around engagement as well. Healthcare providers, I talk a lot about end users of healthcare providers, but healthcare providers need to engage with patients beyond the clinical setting to maintain that communication, offer support, just in terms of what these technologies or these type of reforms mean to them, so that we can actually contribute to their better health outcomes. And that's going to be a key part. So I just wanted to mention, obviously in closing, that the patient is a central stakeholder in everything that we do, and we should never end up losing sight of it, irrespective of what engagement, what project that we're on.
Absolutely. And when I hear the importance of having that be accessible, but also equitable, and that making sure that, it's such a big a country as Canada, or, we do a lot of work with the Department of Education in Alaska. Alaska's a very large place. And it was eye-opening to me living in like downtown Vancouver. I'm not in downtown Vancouver, but that's not the point. When you have folks that are like, hey, I can't print documents, because there's no internet or there's no computers. Like, they need to literally mail stacks of paper for education. And so you think of like Northern Ontario or the Atlantic provinces or wherever, like how can everybody, Northern BC, whatever else, how can you make sure that everybody has those outcomes? It's a challenging job, and it's a tough one, and one I don't envy, but I appreciate you and the folks that you work with at Deloitte and across, the healthcare professionals across Canada, especially the ones on the front line. I will say it's a tough job, and I think we're all, speak on behalf of Canadians, that we're grateful that you do it. So, Shanil, where can people connect with you? Where can they learn more about your work, and where can they learn more about the work that Deloitte does?
Just in terms of the work that Deloitte does, you can always visit our website, where we always have perspectives and point of views that we end up publishing. So we put out a really good paper around the healthcare outlook in 2024. I feel that's a great read. And we also have one around the future of healthcare and where it's going from now until 2040. So that's a great place to check out. And then for me personally, I typically hang out on LinkedIn, where I end up posting articles, op-eds, as well as these type of podcasts as well, just in terms of sharing my perspectives around leadership, healthcare, some of the digital technologies that we see in healthcare. So you can always check that out as well.
Awesome. I appreciate it. Well, thanks for being here. Thanks for making the time. Thanks for doing what you do. And it was just a blast chatting with you. So thanks again.
Thanks so much for having me.
Awesome. Folks, my guest, Shanil Ebrahim, who is a partner at Deloitte. One of the things that I'm taking away from today, whether you're in healthcare or you're not, and whether in Canada or you're not, is the importance of being able to understand how desired changes, desired system change can incorporate with existing systems such that they can be sufficient. We see it with strat plans all the time. We're like, hey, we have this great plan. We have all these great things that we want to implement, but nobody runs it by the folks that are actually doing the work. It gets gets stuck and it doesn't move forward. And when you got something as important on the line as people health outcomes, doing it right and doing it right the first time is so critical, especially when you're using, in this case, public money for a lot of these changes. It's just so important that we have the right leadership and doing the right things to move it forward. So I hope y'all took some stuff that you can incorporate in terms of getting your people on board, not just top down, but bottom up as well. So folks, thanks again for listening to this episode of the Strategy and Leadership Podcast. I'll be sure to include the links for those white papers in the show notes. If you enjoyed today's episode, please give us a review. It helps us get it out to more people and support the people that are driving great change like Dr. Ebrahim. So thank you, everybody. Appreciate it. My name's Anthony Taylor. This has been the Strategy and Leadership Podcast, and I'll see you next time.